Hello and namaskar, I am Sanjeev Pandya welcoming you to the another edition of Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center USA. This show is all about importance of Ayurveda and the health benefits of Ayurveda and the Panchkarma that we discuss with renowned Ayurveda Dr. Ambika Nair, who has over 30 years of experience in treating patients through Ayurveda herbs and Panchkarma treatments. With that note, I'd like to welcome Dr. Ambika Nair to this show. Dr. Nair, welcome to the show. How are you?
Thank you, Sanjeev. Really, it's very, I'm very happy,
Correct.
I should say that, to come for the show, and not only to talk about that, the way you ask the questions. Really, it's really very nice.
Thank you.
And all my viewers also, really, I'm very happy to come, and whatever I can present, I will always do the best for you all.
Very good.
Yeah.
Doctor, it's so good to have you because you bring so much importance and value to this show for our TV Asia viewers. Talk about viewers, I think Dr. Nair, first of all, we should wish them happy Navratri.
A very blessed, happy, prosperous and peaceful. And another thing I'm going to tell is that very, very healthy Navratra for all of you.
Talk about being healthy. Obviously, we wish you that, Ma Durga brings happiness, peace, success in your life and a vibrant health. And to be healthy, obviously, you also need to take care of yourself. And what we discuss in the show, that we pick on a topic and we give you as much information possible. So that way, in case if you or anyone that you know in your family or any one of your friends are affected by disease or sickness, that you would know that how Ayurveda can cure or treat that sickness by Santigram Kerala Ayurveda Wellness Center USA. Dr. Nair, today I think we should talk about a topic which is, I think, very, very important. Many people are affected by this. Many of them, they don't say it, but they are affected by it, and it's called Dysuria.
Oh, yeah, difficulty in passing it. From where you bring all these subjects?
I talk to many of our viewers and they enjoy watching our show, and this is what they have requested to talk about Dysuria.
Very nice, very nice. Dysuria means, see, first of all, when we pass urine, after passing urine, we feel so relieved. As if, like we lost so much pounds of weight,
Correct. So what is Dysuria?
Dysuria means it is a painful mixturation, means a very painful way of passing urine. They want to pass urine, but they cannot. It doesn't come. There will be burning sensation, and it doesn't come actually.
Okay.
Yeah.
And what's the age group of people who can be affected?
Anybody can be affected. Now itself, now this is the Dandiya time, that please, my colleagues, I should say, and my friends, please don't sit for a long time without passing urine, okay? And please drink water also, because otherwise you will also be suffering from dysuria.
So what you're saying is that when you
we
avoid going to the bathroom.
There are so many causes.
Correct.
But I'm telling, because now this is the Navratra season, people won't drink much water. A very nice topic you asked me this time. Really, you are great.
Thank you. Thank you so very much, Doc. So people who actually avoid going to the bathroom, are they ones most likely to be affected by dysuria?
No, actually, ladies are more affected than, men.
Oh, really?
Yeah. Okay. And because actually they will always, okay, I will do it later. बाद में करेगा, थोड़ी देर के बाद जाएगा. They will be holding it. Sometimes nursing mothers, even pregnant women, or anybody like that, they will always hold it.
So by not drinking water or by avoiding going to the bathroom?
No, avoiding also, and if any vulvitis or any inflammation over there also. See, some people, children, I can talk about the children. See, once they, they go and play outside, in the park or something like that, some irritants, especially especially it is mostly seen in the girls also. Okay, some irritants will go to the vaginal area, that vulva area, so they will be itching and all, and the swelling will be there. Then they will have so much of difficulty in passing urine. So many kids comes to me also.
All right.
Yeah,
so now we
girls.
know that it's not only a mid-age or old age group of individuals.
It is in
kids can be affected
very
by
small
dysuria
kids.
also.
Yes, yes.
Okay. What symptoms of this dysuria? What else could happen?
Yeah, because actually symptom means, you know, like you will have a lot of burning sensation. Burning in the sense means you will be running from helter-skelter, you know, like you don't know how to explain it.
Achha.
Okay, and so painful it is, the urine wants to come but it doesn't come. You see, like you see, one boundary is made, the water wants to come out. The hole is totally blocked. What will be the condition?
That could be very frustrating.
Not only frustrating, you will die with the pain. That is another thing. Because how much water you drink, that's why sometimes, you know, in the children and all, we open the tap for a long time and we see the stream, you know, like the running of the water. Some children will pass urine and the causes will be, no. And another thing is that so much pain will be there on their calves, leg calves, you know, and even on the thigh area, lower back ache. Okay.
So what would
stomach ache also, lower abdomen, they will complain of pain. Yeah.
Unbelievable.
Yeah.
What would an average person do in a situation like that?
See, average person, that I'll come to that, okay, because actually this is a big classification. Not only the child will play or something like that, okay, because it will be classified like, you know, diabetes person also can get it, okay, even blood pressure, people with blood pressure also can, any urinary tract infection. Okay, anybody with a urinary infection, any pelvic disease, okay, this dysuria can happen. And in, you know, like in men with enlarged prostate also it can happen. Okay.
So, all right. So, with that information, we're going to take a short break, and when we come back, we'll continue to talk more on dysuria, side effects of dysuria, and what dysuria can lead into another diseases as well. It's all coming up in this Ayurveda Mantra show by Santigram Kerala Ayurveda Wellness Center, USA. Please stay right there. Welcome back to the Ayurveda Mantra show by Santigram Kerala Ayurveda Wellness Center, USA. This episode, we're talking about dysuria. What exactly is dysuria and what dysuria can lead to another diseases as well. So with Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center, USA, I'd like to ask her, what are the causes of dysuria?
I already told you, you know, like repeated, see, like urinary tract infection. Okay, some people will get, they don't, you know, like, they first of all, they will be complaining of lower abdominal pain.
Right.
That is more important. Then burning sensation. Then they cannot walk. Because then, you know, like while passing urine, see if it is ladies means so much of discharge will be there. Okay, so this all one of the reasons. Then any inflammation in the kidney, in the ureter, in the bladder, like cystitis, or any hypertrophy of the cystitis, enlarged prostate, even with the diabetic people, anything like that it will come. And
so,
you know, like
so these symptoms are going to be same if a person is male or female, it doesn't matter?
It will be same only, yeah. Only thing we know, like because in the children, sometimes, you know, like that reflex will be there because of any obstruction. See, that is congenital, that is very rarely seen in children.
And what is exactly a treatment for this dysuria?
I will tell the prevention first.
Sure,
I feel, you know, like prevention is more important. First of all, hygiene. Okay, whatever, you know, like never stop your urination. Okay, this is all natural RG, you know, nature's call. If you hold it for a long time, and especially I have seen that it will really, people will suffer with this actually, because afterwards they will have a lot of issues. Okay. Then after sexual intercourse, they should definitely go and wash. Okay, and they should pass urine also, so that, you know, like after it will flush out everything, all the bacteria. Okay, then the people who indulge in excessive sexual life, and they hold the urine for a long time, especially it is mostly seen in surgeons, you know, like and doctors and all, doctors also, they are not even left with that. Don't think like,
Gotcha. Okay.
And even very, like players, they hold the urine for a long time.
Okay.
Yeah.
Okay. So basically, under prevention, the most important thing that you're suggesting is that do not hold off going to the bathroom.
Do not hold the urine. And
when nature calls, you must go to the bathroom and relieve yourself, you know, as early or as soon as possible.
Yes.
But
and hygiene.
Exactly, and a hygiene also.
Yeah.
But if a person is in the habit of going to the bathroom, you know, for a longer period of time, that person will develop this dysuria.
This not only dysuria, it is a predominating symptom of other diseases. So they will definitely get kidney issues, you know, like kidney problems. And even some people with, you know, like a dysuria can happen even with the renal calculi.
Correct.
Renal calculi means stone in the kidneys. Okay, even any like bladder issues, anything. There are so many causes, you know, like how it will
besides,
come like that.
You know, this thing that you mentioned, what causes dysuria, if somebody has, let's say, a diabetes or blood pressure problem, or let's say arthritis, with those kind of diseases, will that person get dysuria also, or it doesn't matter?
If they don't drink water. If they don't drink water properly, and they should hydrate themselves a lot. And
that
this
is
is water.
That is the key thing. Drink as much water as much possible.
And how much, you know, you see, and if you are getting this dysuria like 3-4 times, you know, like it means then you should always go to the doctor and rule out, you know, like why you are having the issues like this. That is more important. Yeah, that is also because it's not, don't think that because, oh, dysuria, I told like this, so I'm not going to go because now I'll be telling you what all they can do at home.
Correct.
So this is all, you should have a problem, you should go to the doctor also.
All right, and then one goes to a doctor, let's say allopathy doctor, and starts getting this medicine, right? Does it really take a long time for a person to get cured?
Sanjay, you know, like I get a lot of very chronic cases like this urinary infection, yeast infection, you know, like E. coli, all these things, and we get a lot of cases like that. They have been treated for 15 years, 16 years like that. So they are on antibiotics for every month. They at least take twice antibiotics, and even doesn't work, then they come to us.
Yeah. Well, viewers, we are watching the Ayurveda Mantra show by Santigram Kerala Ayurveda Wellness Center USA, and before we go any further, just want to let you know that if you or anyone that you know has any kind of sickness or disease and would like to get help, then you can definitely contact Santigram Kerala Ayurveda Wellness Center USA, or you can send us an email, info@santigramusa.com. You'll see the email ID on the screen. That's info@santigramusa.com, and Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center USA will definitely address the question, will also help you out by getting in touch with you. But the main point is that should you experiencing this kind of symptoms that we just talked about, like dysuria, then please do not wait any longer and try to get help as early as possible. And Ayurveda, how Ayurveda can prevent and cure this dysuria problem, that we're going to talk about that right after the break, so please don't go anywhere. Welcome back to the Ayurveda Mantra show by Santigram Kerala Ayurveda Wellness Center USA, and we'd like to say thank you so much for watching the show, and thank you for contacting us at info@ayurvedausa.com. We're talking about dysuria, and Dr. Ambika Nair mentioned that dysuria is mainly in the female, but it is also seen in the male as well. Can you give us more details about male patients?
Yeah, in male actually, you know, it will not be seen in the young stage, you know, unless they have any disease from the kidneys or any obstruction that is there. Okay, otherwise, you know, with the enlarged prostate only it will come people after 50 years of age. Okay, due to the enlargement of the prostate.
Acha.
Okay, that is, bilateral, hypertrophy.
That is quite common, huh?
That is very quite common because of the, the stress factor is one of the reasons.
And that's why they say people over 50 must have their
PSA.
prostate checked in, regularly checked in, blood work and everything.
To rule out cancer and everything. That is very good actually.
Okay.
Not only that, they can go for ultrasound. If they feel anything like that, like urine ke liye baith jayega, but urine doesn't come. Even after men, it is very common. That's what I'm talking about. Okay, after passing urine, they will have little dribbling. Like after passing urine, they feel like going again. So the frequency, that urge is more and more.
Correct.
Okay, so the dribbling will be there, like like 3-4 drops only will be there. Then after that, it takes really little time, and when they sit for urination also, it will take long time for them to pass urine, and the flow will be very, very slow, like very thready slow.
That can be very painful. I remember reading it somewhere, dysuria and enlarged prostate. How does that relate and what happens?
Because it comes and press the bladder.
Right.
Because it's the prostate is a small gland only. According, like as you age, it also grows.
Right.
Then some people get the hypertrophy.
Correct.
Okay, then it compresses the bladder. That's the thing. It comes and presses.
I see.
So the bladder is pressed, so that urge will be there always.
I see.
Yeah.
Oh, okay. Now let's just talk about cure. How can this be cured at any one of Santigram Kerala Ayurveda Wellness Center locations in the USA, doctor?
We can always tell that first of all, what they will, prevention is better than cure.
Absolutely.
So if you have an issue like that, you should always, how can you prevent it? That is more important. Okay. So home remedies, I will tell them. Okay. If you have an issue, see, we all have, all the Indian families will have little bit of barley at home, jav. Okay, take 1 tablespoon, boil it with 2-3 glasses of water, that you drink it. You can drink it with even with honey. If you don't have honey at home also, just drink it. At least 2-3 glasses, you can see how it will go. Okay.
Barley and honey.
Barley and honey. Okay. And like another thing is that, jaggery with hot milk. Thoda sa good. एक गरम दूध के साथ just take it.
Oh, that's
something that is very.
I've never heard that.
Yeah, it is very nice actually. Ayurveda में तो बहुत है यार.
So ये hot milk के साथ थोड़ा सा good मिला.
Good मिला कर पिए. You can use it as a regular practice also. I से पी लेना.
Exactly. मैं definitely कोशिश करूँगा. And Dr. Nair always says that most of these problems cure is in our kitchen.
Our kitchen is the best Ayurvedic store. और cardamom. Okay, cardamom का थोड़ा सा ना वो उसका छिलका निकाल के वो पाउडर को करके like you can use with actually with even gokshura है, that is a medicine actually, and honey मिलाकर you can just take it. Otherwise even with the turmeric, like haldi or amla powder, एक चम्मच, and that you can take it. There are so many things what you can do.
Very nice.
Yeah, very nice it is actually.
Interesting. So barley and then a little bit of honey, then hot water, and then good, and also cardamom. These are some of the things that Dr. Nair mentioned. That's the mantra, that's the Ayurveda mantra of the day in this episode. And should you want to get more information about this, you can send an email to Dr. Nair, info@santigramusa.com. Now, Dr. Nair, let's talk about important stuff. Curing this dysuria or enlargement of prostate and anything else at Santigram Kerala Ayurveda Wellness Center USA. When a patient comes to you, what is the first step and how do you treat them?
I'm talking to everybody now because they all, like they think that because like they will tell everything to me. But in Ayurveda, what we do is the pulse analysis. That is the Nadi Pariksha. So when I do the Nadi Pariksha itself, we know the causes actually. Nadi Pariksha is not I am taking your pulse. We see through the pulse your internal organs. That is more important. Okay, then we know that if any scar inside, anything we know how to diagnose it properly. Then we do treat for the cause actually.
So when you say pulse, normally you go to doctor has a stethoscope, right? Doctor uses stethoscope. But Ayurveda doctors normally don't use stethoscope. They use their couple of fingers and then they read pulse, right?
Yes, and like if you have anything like that, nothing is there, drink coconut water, okay?
Okay.
Coconut water, cranberry juice, this is all very good actually.
Sure, and the cure for this dysuria includes what? A panchakarma and...
Panchakarma is also there with the diet also.
Any pills?
If panchakarma is needed we will tell them. You understand now?
Otherwise
Some
pills?
people doesn't need panchakarma. Not that everybody needs panchakarma.
Ji.
So sometimes it will be very, very easy.
Okay.
So that like maybe they have a very bad constipation.
Correct.
Okay, and their digestion is very poor.
Okay.
So that bloated abdomen with everything. So they will have dysuria also.
So then you put them on a strict diet?
Yeah, we will give them, like in panchakarma. At that time, I will do the panchakarma for them. So the detoxification we will do.
Correct.
And then you can see that how they will be having a proper
And when
way.
you put them on diet, any certain food that they should avoid?
Yeah, we will be giving them only cooked food. That also khichdi. Everybody knows that I am very famous for khichdi and cooked food.
Yeah,
Okay,
exactly.
and then we tell them to take some, like some herbs are there, like related with the, like the disease, and it helps them a lot very nicely.
All right.
Yeah.
Okay. So, viewers, at the end of this episode, as we come to know that dysuria and enlargement of prostate, it can be cured at Santigram Kerala Ayurveda Wellness Center, USA. And Dr. Ambika Nair always says that prevention is better than a cure, and most of the remedies are in everyone's kitchen. So you should have that, a little bit of barley, a little bit of honey, and then of course warm milk or good uske saath
Yeah,
mila lo.
even turmeric is very good with
Turmeric is
warm
good.
water and honey. That all help them a lot.
Absolutely. And of course, for more information, you can definitely contact info@santigramusa.com. Every week in this show, let you know importance of Ayurveda, herbs and Panchkarma treatments, and how it can help you to live a happy and healthy life, and also at the same time have a vibrant health. You may have gone to your doctor and you maybe are trying allopathy and everything, and suppose if it's not working out or the result is not satisfactory, then Ayurveda is an option that you should really sincerely consider. And Santigram Kerala Ayurveda Wellness Center's location near you can definitely help you out, can definitely guide you, and that's what we let you know in this show with Dr. Ambika Nair. Doctor, what can I say? Thank you so very much.
Yeah, Sanjeev, you told a correct one, if you are not satisfied with your allopathic doctors, because everybody comes as a chronic case. Yeah.
If you're not satisfied, or if you think the result is not
that's what I'm
satisfactory,
telling. Everybody will be a very chronic case. When everybody wash up the hands, then they want in Ayurveda.
So instead of going for Ayurveda, in the end, at the last, try to go to see Ayurveda
Any
doctor,
Ayurvedic
or
doctor,
start Ayurveda treatment in the beginning, and then you will see the difference. With that note, we come to an end of this Ayurveda Mantra show this week right here on TV Asia. We'd like to thank Dr. Ambika Nair for her guidance and suggestion. Dr. Nair, thank you so very much.
Thank you, Sanjeev.
Thank you, and we'll see you next week right here on the same place, same time. Till then, you live happily and peacefully. So long.